Hey everyone, it's Cerebral Palsy Awareness Week. So let's get to know more about cerebral palsy. What actually is cerebral palsy? It is a group of disorders that affect a person's ability to move and maintain balance and posture. It is caused by abnormal brain development or damage to the developing brain, often before birth. How common is it? Actually, it's the most common motor disability in childhood, which affects 17 million people worldwide. Unfortunately, every hour one baby is born with cerebral palsy. But what causes this disorder? The etiology of cerebral palsy is very diverse and multifactorial. The causes can be congenital, genetic, inflammatory, infectious, anoxic, traumatic, and metabolic. The injury to the developing brain may be prenatal, natal, or postnatal. So let's understand the risks in depth. So risks in prenatal period, which is from conception to the onset of labor, can be prematurity gestational age, less than 36 weeks, low birth weight less than 2,500 grams, which could be due to poor nutritional status of the mother, maternal epilepsy, hyperthyroidism, infections, torch equals toxoplasmosis, other syphilis, varicella zoster, parvovirus B19, rubella, cytomegalovirus CMV, herpes simplex virus, severe toxemia, eclampsia, drug abuse, trauma, multiple pregnancies, or placental insufficiency. For perinatal period, that is, from 28 weeks intrauterine to 7 days, risk factors can be premature rupture of membranes, prolonged and difficult labor, vaginal bleeding at the time of admission for labor, or bradycardia. In postnatal period, that lasts till first 2 or 5 years of life, the risks can be central nervous system infection, encephalitis, meningitis, hypoxia, seizures, coagulopathies, neonatal hyperbilirubinemia, or head trauma. Now that we know about the causes and risk factors, let's understand the types of cerebral palsy. So anatomically, it could be identified by 2 types: unilateral, when only one side of the body is affected, or bilateral, in which both sides of the body are affected. It can then further be classified by spastic cerebral palsy. Spasticity is defined as an increase in the physiological resistance of muscle to passive motion. It is the most common type of cerebral palsy. It can be subcategorized by hemiplegia, diplegia, quadriplegia. Spastic CP can either be unilateral or bilateral. Dyskinetic cerebral palsy. Abnormal movements that occur when the child initiates movement are named dyskinesias. It is characterized by abnormal pattern of posture and or movement, and involuntary, uncontrolled, recurring, occasionally stereotyped movements of affected body parts. It is always bilateral. Ataxic cerebral palsy. Ataxia is loss of balance, coordination, and fine motor control. Ataxic children cannot coordinate their movements. It becomes apparent toward the age of 2 to 3 years. Ataxia is often combined with spastic diplegia. Most ataxic children can walk, but some need walkers. Ataxic cerebral palsy is characterized by the following symptoms: abnormal pattern of posture or movement, and loss of orderly muscular coordination, so that movements are performed with abnormal force, rhythm, and accuracy. It is always bilateral. Mixed cerebral palsy. Children with a mixed type of cerebral palsy commonly have mild spasticity, dystonia, or athetoid movements. Ataxia may be a component of the motor dysfunction in children in this group. Ataxia and spasticity often occur together. What are the signs and symptoms of cerebral palsy? It can be divided into 3 domains: neurological, musculoskeletal, and other associated problems. Neurological issues commonly faced by children with cerebral palsy are muscle weakness, abnormal muscle tone, balance problems, loss of selective control, pathological reflexes, loss of sensation, and swallowing difficulty. Musculoskeletal issues are usually contractures and deformities. Other problems may include epilepsy, visual problems, hearing loss, speech and communication, feeding difficulty and failure to thrive, respiratory problems, incontinence, and intellectual impairment. Diagnosis is usually made during infancy or childhood. There is no one test to confirm if a child has cerebral palsy or something else. There is no blueprint of interventions for a child with cerebral palsy, and each child is different and unique. Classification of gross motor, fine motor, and communication will help medical professionals and the family to better understand the abilities of the child and what to focus on for interventions. Unfortunately, there is no cure for cerebral palsy, but treatment can help in managing symptoms, medication for muscle stiffness, surgery for bone, muscle abnormality correction, early intervention and therapy, physical therapy, occupational therapy, and speech therapy. Living with cerebral palsy can be challenging, as it is a lifelong condition, but many individuals live fulfilling, productive lives with support, such as adaptive equipment and assistive technology can significantly improve quality of life, and community support and accessibility plays an important role. While it's challenging enough to live with a disability, people with cerebral palsy also face social barriers, including accessibility issues, misunderstanding or stigma, difficulty finding employment, and educational opportunities. But we can help break these barriers by fostering an inclusive and supportive society. We can help by raising awareness about cerebral palsy, can help improve access to resources, services, and support. Advocacy is crucial in pushing for policies that promote accessibility, healthcare, and inclusive education. Together, we can create a world that is inclusive and supportive for individuals with cerebral palsy. Thank you so much for watching. Get in touch with us by contacting us on our social media accounts.